I'm going to share my PowerPoint. All right. So can everyone see my screen?
Yes.
Yes.
Okay. All right. Let me go to. Did that change for you all? Is it a grid view now? Or are you just seeing one big slide?
Mine
One
didn't
big slide.
change. One big slide.
Okay. All right. So we will go ahead and get started. So I want to thank everyone for allowing me to take some of the time out of our normal weekly meeting to present you with some more information about social determinants of health. So today we're going to talk about what the social determinants of health are, and once we have all of this data, what can we do with that data to start making impacts to those people that are identified as maybe being impacted by a social determinant of health. So after today's presentation, you will be able to define social determinants of health, understand the negative impacts of them, identify who collects the data and what tools can be used, explain how the data is collected and analyzed, and then identify how to break down the barriers to provide benefits to the underserved populations. And this is in line with Healthy People 2030 goals, which we'll talk about later on. All right. So first, we're going to start with what are the social determinants of health? So these are your non-medical conditions that impact patients in their personal lives and affect their health and well-being. So the first set of them that you have are the economic stability social determinants, and those are a person's employment status, the income they have versus their expenses, if they have high amounts of debt, medical bills, and the lack of support in taking care of some of those economic issues. The next one is the neighborhood and built environment. And this is where your housing is covered, transportation needs, safety of the neighborhood. Are there parks and playgrounds where people can go and exercise and get some movement in? If there are they walkable? Can you get there on foot, or do you need a car to get there? And education is next. So that is where your literacy comes into play, types of languages that are spoken in the community, or is there access to higher education or vocational training, and also what kind of early childhood education is available in the area. And then moving down the list, we have nutrition, which this is just access to healthy food and clean water. Then we have the social and community context. So this is your social integration with community engagement and support systems. Are there, for seniors in particular, are there places like senior centers where they can go and interact with their peers and get support from resources that those kind of organizations provide? And then we have our health and healthcare, which is your insurance coverage, provider availability, cultural competency, and the overall quality of care that is available in that particular area. So now we're going to talk about the negative impacts on health. So patients that are experiencing social determinants of health have higher rates of mortality, which is the state of being destined to die, higher rates of morbidity, and this is the rate of a disease in the population, so higher rates of certain diseases. Life expectancy is shorter for those that experience the social determinants of health. Health expenditures So these are the ones where resources available and other, sometimes it can be monetary limitations that can impact them. And then the overall health status. And this can come from, people not having access to screenings for early interventions, things to keep them healthy overall. And then the last one is functional limitations. So some of the conditions that these patients experience can lead to disabilities overall. All right, so now we're going to talk about who screens and assesses the patient. So multiple providers across the healthcare system or setting can screen and assess patients. This includes providers, social workers, community health workers, case managers, patient navigators, and nurses. And this can be collected in multiple different ways at different times. There can be certain intake forms that are used, screening tools, patient-provider interaction, and these can also be reported by the patient themselves. Okay, so this slide here, this is a case study that I found during my research that was done to help providers see the benefit of starting to document and screen these conditions in the medical record. As we know, we don't want to burden providers with more documentation requirements. We're always asking them to add more and to do more. So that is one barrier that's, kind of step one is getting them to understand what the benefit is and why they should do it. So they did a case study, and after they looked at all of their data, they analyzed those social determinant of health conditions that the physicians and providers did document. And the findings showed that patients with diagnosis code were older, female, uninsured, living in low income and high employment neighborhoods, and higher number of hospitalizations overall for this group. So what they did also was they looked at, along with the social determinant of health codes, they looked at codes for diabetes in particular to see, is there a correlation between these groups, the older females that are uninsured, living in low income with higher number of hospitalizations, is there a relation to that with the diabetes? And they could definitely see that there was. So this information was presented to the group of physicians to say, this is what we are able to do if you screen and document those conditions. We can pull out those certain populations of people and figure out, what do we need to do to help them? What kind of resources do they not have that we might be able to find for them and get in place? Okay, so next we're going to go into the screening tool. So once we have the buy-in from providers and those that are screening for these, the next question is, how are we going to screen for them? There's so many different ways. There's so many different questions that can be asked. So one of the available tools is the AHC HRSN screening tool. And this was created by CMS. And I just took a screenshot of one of the first pages. I think it's 5 pages long, but it just gives you an example of those conditions that they screen for. And it's nice because it's a structured assessment. So if this is something that a facility or organization would choose to use, it's nice because everybody is going to be collecting the same information in the same way. So this is one that could be used in different settings also. It could be inpatient, outpatient, clinics, if you're coming into the hospital for an outpatient procedure. And then the next one that we're going to look at is the National Comprehensive Cancer Network Distress Thermometer. So this is designed specifically for patients that have a cancer diagnosis. It has very, very similar questions to the CMS screening tool. So one of the things that I have done in my role now, when we first started talking about social determinants of health, one of the questions that I got came from the oncology group. And when we were talking about screening, they brought this up, that we have this tool that we're already using. They use this tool once the patient is diagnosed. They'll use it anytime a patient's treatment plan changes, if they're getting different doses of radiation or they're going to try a new form of chemotherapy, or any time that the provider might think that something is going on, they can use this tool. So we compared this with population health and oncology. They looked at them together, and population health realized that the information that needs to be captured for social determinants of health is already being captured in this. So I wanted to point this out to, just so people can understand that some specialties might already have something in place that they're using. So it's important to say, yes, you can continue to use that. We're going to get the information that we need, and we're not going to be adding duplicate work to your workflow that might just end up taking more time when you're already doing it. All right, so now we're going to talk about how is the social determinant of health data collected. And I think we all know the answer to this. It's with those ICD-10 CM Z codes. So we have our list here of Z55 through Z65. And these are all of the codes that are related to those social determinants. So we have our education and literacy, employment and unemployment, occupational risk factors, problems relating to housing and economic circumstances, problems with the social environment, problems with upbringing, other problems that are related to support group and family circumstances, and then those psychosocial circumstances as well. Now for how do we use this data? So we've talked about what the social determinants of health are, who can collect them and what the negative impacts are, and how we can help support the importance to providers and caregivers of screening and documenting these. So once we have all of that covered and we're starting to get the data, we can use that to improve the quality of care, to coordinate better care, and the experience of overall care. So we're going to use that to identify these patients, inform those groups or teams who are needed to help find those resources and coordinate that care, trigger the alert to say, hey, there's something going on here, and then we're going to use it to track the process. So we can say, okay, we're going to look at this group. We're going to work with this team to make sure we can get them connected with the resources they need. And then we're going to continue to track that to see if those resources that were provided had made any positive impact to help that population of patients. Next thing I have here is a screenshot of some data that you can get from CMS's website that's called data.cms.gov. So I thought that this was really interesting, and this is something that anybody can go out and do. So you can look at social determinants of health from a national standpoint all the way down to a state or county view. So this one, they have a couple of different things that you can choose from. On this one, I chose percent of housing with no transportation. So that would be those people that, they can't get to their doctor's appointments, which when it comes to screening or just keeping up with your normal health maintenance, if you don't have transportation to get there, you're kind of stuck from step one because you can't even get there. So I thought that that was interesting to see where those pockets of people are. You can see down here, the bottom, as you get into the darker blue areas, shows the areas where there are people that have that social determinant of health happening. They do not have the transportation to help them get to where they need. So our next slide here is the same view, but this takes you down to more of a state level. So you can see the darker areas within our state are the ones where we might have patients that are impacted by that social determinant of health of not having transportation. And then like over here, how I said, you can, if you want to, if anybody goes out and browses and look at this, you can get all the way down to the county level, which I think is really neat that they have this information and this tool available for anybody that you can go on there and use it anytime. And then our next slide that we're going to look at, this is the one that we have created for our health system. So it right now is tracking the volume of social determinants of health, the top 20 payers. And then at the bottom there, it shows you where the darker the color, the more prevalent that condition is. And that was one that Megan created for us to use internally. And we have found a couple of things on it. When she runs the report, she looks to see, are there any spikes in certain codes? And we have found a couple of areas where the code was not being used correctly. And it was kind of making that group of patients, giving them a false diagnosis, if you want to say that. The one that we found in particular was problems with literacy. And once we started looking at those, we realized that that was not correct because there were the patients that were showing up did not, once you looked through their documentation and what was going on, there was not any literacy problems identified. It looked like it was coming from a template or something like that. So what we can do in those situations is go and work with that provider or group of providers and just make sure that they realize what they're documenting, and the importance of making sure that you're documenting it correctly because you don't want to give somebody a condition that they don't have. Now for our next slide, we're going to talk about Healthy People 2030. So this was a program that was designed by the U.S. Department of Health and Human Services, Office of Disease Prevention and Health Promotion. And it identifies 5 areas for addressing social determinants of health. And these are linked to the first slide that we looked at. So we have your social connectedness, your community clinical linkages, tobacco-free policy, the built environment, and your food and nutrition insecurity. So as we gather all this data and we're working with all of the providers and caregivers and teams to make sure that we're doing what we can to help these patients in these populations, how do we reach these goals that are outlined in Healthy People 2030? So the first thing that we can do that we had talked about before is educate the providers on the framework for health equity. And this is structured to align with the Health and Human Services initiatives that will help achieve health equity and reduce disparities among minorities and underserved populations. So as of January 1st, 2024, CMS requires health organizations to screen for 5 social determinants of health. And those 5 requirements are for food insecurity, interpersonal safety, housing insecurity, transportation insecurity, and utilities. And these are requirements for hospitals and health systems that admit patients. So these would be for those organizations where you're admitting people as an inpatient status. Mandatory screening for these will be expanded to include outpatient settings, starting with voluntary reporting in 2025 and then moving to mandatory reporting in 2026. So we're seeing it now on the inpatient side, and then as we move along, it'll become a requirement across the board. So then we have to address social determinants of health as a part of routine screening. So anytime somebody's coming in for an annual wellness visit or just your normal physical that you're going to see your doctor for, we need to start addressing these and asking about them during that, not waiting until we think that something's going on. We can use evidence-based research. So like on the slide where we looked at that case study, use research that has some background to it that says, if you do this, we can identify good information from it and we can help people. So do that data analysis and integration. So that means sharing the information with people, getting the data, looking at it, finding those trends, triggering action, and then sharing it so that all of the partners and teams can understand who is impacted by these and what we can do. Multi-sector partnerships. So this just comes from private organizations, government organizations, community organizations. Everybody's going to have to work together to provide resources for these patients to help them get through some of these impacts that they're experiencing. And then building community trust. And I think this one is important because some of these questions can be very sensitive. And I think that some patients might hold back from reporting it. So if we can build that trust with the community where they know if I give them this information, although it might be uncomfortable for me, they are going to do something with it that's going to help me. So make sure that they understand that when we ask these questions, they're being asked for good reasons and to help. That nothing is held against anybody because they might be experiencing one of these conditions. And then the last one there is to promote and implement health enhancing policies. And this can just be across the board. Like they mentioned the tobacco-free policy, promote that everywhere. Exercise, if you do have those areas where there's a park or a green space or somewhere where you can go and get your body moving, promote that, maybe plan some activities or something like that that will get people more involved and out and moving. So next we're going to talk about some more evidence-based research that shows that when everybody works together and we're following all of those steps that we had talked about before, that it works. So Kaiser Permanente has a Thrive Local Initiative program, and Boston Medical Center has the We Care program. So both of these organizations used social determinant of health data that was captured from the screening tools and incorporated into the medical record documentation to guide overall patient care. So Kaiser Permanente's program, it assesses a patient's physical, mental, and social conditions and then matches them to related needs for the appropriate services available in that community. And based on their data that was collected, 63% of Northern California members had at least one unmet social need. 29% of the members reported insecurity of food as the largest medical challenge, and 23% reported instability with housing. So their program has helped create a number of different programs. They created 5,000 affordable housing units and services to help with access to food and support healthy relationships. And for Boston Medical Center's We Care program, they launched this to identify the unmet social determinant of health needs and to offer interventions or the lack of the needed resources. So through the We Care program, a person's access to food pantries and employment services increased from 8% to 70%. And enrollment in community programs such as public housing and Head Start programs for early education increased from 24% to 39%. So I thought that those were two good examples of organizations that have been collecting this data, and they have already been able to use it to make positive impacts for their group of patients who are impacted by social determinants. So in summary, social determinants of health have negative impacts. To help break down the barriers, we need to collect the data, have accurate documentation, work with multiple different teams, organization within the organization, with outside of the organization, to help these populations when we identify the trends and start the process of figuring out what resources do they need. Do they need more preventative treatment? Do they need additional community resources? Is there a need for additional medical resources? And then we also want to do all of this to lessen the burden on the patient and the healthcare system. So if we would start to address some of these conditions early by screening for them, it really does lessen the burden. Patients can have less doctor's visits, less admissions to the hospital, which overall is better for the healthcare system. It keeps the cost down and gives the healthcare system opportunities to treat the patients who really are sick, and keep those out of the hospital that could have, where their condition might have been able to be prevented if somebody had just asked about it, and then gotten that patient the help that they need. All right, so now I'm gonna do a little pop quiz. Easy questions though. And anybody can come off mute and answer. You can put it in the chat however you feel comfortable. So first is, who can screen for SDOH conditions?
Any healthcare provider?
Yes, that's right, Judy. Which I thought was interesting too. And I think that that's a good thing because it takes the burden off of the physician in particular, and gives more people opportunities to ask the questions. And I think it also gives more time. If somebody, a nurse, or some places I have read, they have registration staff do it. I don't know. I don't know how I feel about that one. I think it would depend on where the registration is done. I think if it's just in a waiting room, I don't think it would be appropriate to be asking some of those types of questions, but some places do go that route. So I think the option to have multiple different teams and people being available to ask the question definitely helps a lot. So question number 2, what social determinant of health codes are CCs?
Homelessness is one, isn't it?
Yes, you are correct. So those are the ones that CMS they've designated those as CCs. And this is an area too, I also think as I watch things progress, I think we're just going to see more and more of these codes that will become CCs. But I also like the fact that they're kind of starting with one. So we can get in the habit of, we want to screen for all of them, but for sure we want to get these, kind of get everybody into the process and comfortable with asking about those. So question number 3, what CMS requirement mandates that hospitals and healthcare organizations screen for the 5 SDOH domains for admitted patients starting in January of 2024? I can't see my chat. HHS. That's part of it. So the actual requirement is the framework for health equity that was created by, or it was designed to align with the Health and Human Services initiatives. Question number 4, who designed Healthy People 2030? All right, I'm going to give you the answer to this one. So this is the U.S. Department of Health and Human Services, Office of Disease Prevention and Health Promotion. And question number 5, what 2 organizations have programs in place that are positively impacting patients who experience social determinants of health?
Permanente is one of them. I can't remember the other one.
Boston Medical Center, I think.
Yes. All right. So you guys did good. All right, we just have a couple more to go. So we're at the questions for me. So does anybody have any questions or comments or anything they would like to say about the information presented? Ramona?
I just had a question if you noticed any of case management, their involvement in any of this while you were doing your research. Did you notice any? I mean, they're like frontline. That would be where hospitals would get that.
Right. And that it was a
information.
big part of it. Especially with like when they're getting ready for discharge. You know, that's when they come in too, and they can, if they identify something, they can start to work on that before the patient even leaves the hospital, to see if there's places that they can connect the patient with. You know, and if they can't, I think if they can't do something about it right away, it's still good that we have that data. And that's something where the care managers can go back and check and see what is going on. I also think it's important too for them, for that team where they could look at things. If a patient is having frequent admissions to the hospital, and they know there's something going on, that's just another step where, you know, they might know they have to step in a little bit heavier to say, we're trying to get this fixed. We know that this will help the patient. You know, let's do everything we can to help them. So then we can maybe reduce some of those readmissions if they keep coming back frequently.
I just want to say this was a really good presentation.
Thank you, Taylor. One step closer to graduation. So I have learned a lot just from this and everything that we've been doing for school. I had to complete some professional practice hours, and I did that with some of the teams that I don't work with on a daily basis. So it was really eye-opening to me to watch some of their processes, and some of the things that they do are very, very complex. And I don't think you realize that until you see it in action. And it really amazes me how everybody still gets everything done. They meet their goals, even with the crazy volume of patients that we have. So it has been a very rewarding experience. And then the last thing I have here are just my references. So this is all very good information. I think I could probably research social determinants of health nonstop. There's a lot of good information out there, and I think that we're finally getting to the point where we're going to start getting real data. The more and more we get the message out to people, the more and more they become requirements for reporting. So I think that within our health system, I think we're on a good track. You know, we have the volumes, we can see when there's fluctuations, we can see if there's those pockets of patients. We know that population health is working on the screening tool that everybody will that will use across the system. And I've looked at a couple of records, and I think it was on an H&P. I can't remember what service it was for or what facility, but they did have a section on there that specifically said social determinants of health. So I thought that that was interesting that you're starting to see it called out with its own header on our notes also. So I think we're moving in the right direction with it. Right. So I'm going to go ahead and stop the recording.